Hello, friends. We are live. Oh, we have a kitty appearance today. He has been all over me because this past weekend I went and stayed the night at my mom's house just to visit. Oh no, my temporary clown spreading it, trying to use drugstore tooth putty like dentist said, but still really hurts. Be glad to get it fixed soon, right? Because that sounds very painful. I don't know what it is, but I have a high pain threshold. But when it comes to my teeth, Um, so hey Wavy, hey Joe. And I saw metal music popped in earlier. Hello. Hey Cheetah. Patrick, how you doing? House Panther. Yes, we have an appearance today. He's blessing us. Hey Brandy. I want everybody to see how pretty he is. This is my snuggly lovey one. Mhm. He thinks he's a baby. He said, I'm just a baby. Hey Brandy. Thank you. Hello, Jamie, beautiful Jamie. She gets to see the kitty too. He's making a unusual appearance, but he's been very needy. You know how cold it's. I'm in Michigan, so today it's 30 degrees, and they have that catio. They're like, too cold, too cold. Yes, that one's my. I have two, but he's the more baby of the two. The other one is more like a cat. He's kind of a big brute. Thank you, Cheetah. Thank you. Tooth pain is the worst. I live in pain every day and do well, but tooth pain, it really is, Joe. It really is. And I don't know why, but when it comes to the dentist, first of all, I'm not a regular goer because I've never, even when I was a kid, I always had a cavity. I've never gone to the dentist and not had a cavity. So, and let's see. And it's freezing here too. Yes. They don't like it. And so I'm supposed to entertain them apparently, and I'm not doing a good job of it. So hello to one and all. Jamie said, hello, beautiful Joe. My sister informed me that all these hellos at the beginning are kind of boring. So I enjoy saying hello to everybody, but if it bores you guys, you can let me know. I mean, she's like, did you speed it? She said, I need to go back and speed all my old lives up because she couldn't get past the beginning. So she didn't watch it. But peroxide on your bed 2-3 times a day. Let it sit on your tree for as long as you can stand it. Okay, I've never heard that. My husband does the old wives' tale where he takes an aspirin, like just a regular aspirin, and he puts it in the tooth, but he doesn't do that anymore because he doesn't have a lot of his teeth. So I'm glad you do, Brandy, because I love the hellos as well. It got really cold here. Oh yeah, yeah. And we got snow Sunday, right? You guys got it worse, Patrick. You got it worse than I did down in Monroe. I do if I have abscesses. Thank you. She's like, I just couldn't, my attention deficit disorder or whatever she thinks she has, she couldn't. She's like, yeah, I just turned it off. I'm like, well, you could use, Jamie said, I use the mouthwash Peroxyl and it works great. Okay. Yes. Well, you have to say hi to everybody, right? She's like, it just took forever. And I'm like, okay. So I'll see if there's some way I can go back and edit. I got to go clean and vaccine my car. Oh, and vacuum my car. All right, Brandy, have a good day. So today, hubby about to get it tagged. Okay, great. So you can drive it now. Yeah. So today we're talking about chronic pain because next Wednesday we're going to have our chronic pain panel finally. Dun, dun, dun. So I've started to chat with my chronic pain lovelies, and we are talking about next Wednesday coming on. And so I'm going to put on my community tab and ask for questions, see if anybody wants to ask a question. And my sister wanted me to get in touch with Lazarus Naturals to see if somebody would actually come and talk. And I did contact them, but I have not received anything back. So we'll see. But we may talk about CBD as well. We'll see what questions we get. If we don't get any questions, then we'll try to talk about CBD and pain relief that way. Don't forget to give our host a thumbs up. Thank you, Jamie. I need to do that to me as well, because I'm right here. There I am. Uh-oh. I was on my live. There I am. Okay. There I am. There we go. What? So I'm live, and I'm right here, and I'm live, and I'm looking. Okay. So 246 thumbs up. That can't be right. For watching 2 hours ago. No, my live wasn't 2 hours ago. I think something's going on with YouTube, guys. Do you take plain CBD or the mix of CBD and THC? I have tried the mix of CBD and THC, and when I just need to sleep, it does help. But I don't sleep as long or as good with that as I do with just CBD. Now, I'm talking about CBD 300 milligrams a night. That's enough to get me to sleep and help with my pain. So I don't take it during the day, but if I am in a lot of pain, I have a vape pen that has CBD only in it. And I have one that also has just THC in it. So depending on my pain level, I can use those as that. But for sleep, CBD is for me. The THC does not help me with the sleep. So I do not prefer it for that. And then during the day, of course, I'm not using the THC. If I'm in a lot of pain, I'll wait till that nighttime and I will use it then. Do you want it to be on all 3 channels or no? What 3 channels? Oh, I think if we want to do that, Jamie, we're on the free right now. We have to pay. So we will need to chat after this live, after later on tonight, if you don't mind. Chronic Pain Live. Woo woo, yeah. Well, I asked Jen as well, and I don't think I've heard back from Jen yet. But I should have looked at all this before we started, right? Crystal, what are you doing? But the Chronic Pain Live, right now, even on, because I'm not in your account, it keeps kicking me out, and I think it's because we're on the free one where it would keep me logged in before when we were paying for it. So it keeps kicking me out. So I went to my free one. So that's what I'm on right now. I don't know if Joe is interested in getting any of that. If she needs watch hours, that would be fine. But remember too that nobody's really said anything but Joe. So I haven't heard anything from Jen. It's Jen's Hangout, right? That's who I text or who I messaged on Instagram. So she may not be available right now. I don't know how she's feeling. But yeah, I take the CBD. I've tried the mix with CBD and THC. I can pay no problem. I got paid today. So if you decide, yes, I will. I am listening, but won't be typing much. My arthritis in hand is cramping. It's turned a little chilly. Okay. Yeah, we are having freezing temperatures up here in Michigan. Are you in Florida, Wilma? I did see that your address is in Florida when you messaged me. So, but today I put introduction to chronic pain because I want to do the live next week and see if we can get any questions. Yes. So, a chill for you there is yeah. You're feeling it as well? Yeah. We got the cold temperatures probably the week before Thanksgiving, so my thumb, it's not supposed to be that fat. It's been swollen for about 2 weeks. And it hurts more or less depending on the day. And then as long as I take my CBD, the pain is manageable. If I forget it the next day, the pain is like, ugh, Krista. Figures I get paid the day after all the great sales. Right, right. I know. But that's probably a good thing, Jamie, because I bought, well, we needed some of the stuff I got for Black Friday sales. Got my husband some jeans, a new coat. I got myself some new little sweat outfits from Walmart. Nothing fancy really. New sheets we needed. Did I say new sheets we needed? Um, so we got a lot of stuff we needed. But I will tell you, and it's on its way, my Danessa Myricks palette. I'm so excited for that. That was my special prize for me. So yeah. Okay, so we're doing introduction to chronic pain. I just want to talk about the definitions and how it's different from acute pain, where some people may not know the difference. And then I have a lot of like, we're talking about chronic pain, even though I am a mental health advocate, because chronic pain and mental health do go together. They are not the same, they are different, but they can be connected. You can have chronic pain and not have mental health issues. I got 30% off, Jamie, for Black Friday. I was going to get it for the 20% and it wouldn't go through. I couldn't get it to work. So I was like, okay, I'm going to wait till Black Friday. If it's out of stock, you just weren't meant to get it. You just weren't meant to get it. So it was actually the Wednesday before. And you know how the sales all start early anyway. Chronic pain and mental health do go hand in hand for a lot of people. A lot of people have one or the other, but most, the percentages, we're going to talk about that too. Percentages. Hi, Christina. How are you doing? And your pups. Oh my gosh, they're so cute. My cats are like your dogs. When they see the snow and they'll walk out a little bit and then they're like, no, I'm coming back in. Let's see. Meet Joe. Just ask my hubby. Oh yeah. So chronic pain for you as well goes hand in hand. Yeah. Yeah, it really does for a lot of people, because what happens is if you if you have chronic pain, it gets progressively worse. There is no cure for it. So what happens is if you're not mental health challenged like I am, I was first mental health challenged, then I developed the chronic pain. But if you develop the chronic pain first, a lot of times people become depressed. Your mobility is limited and it causes mental health issues as well. But again, like not everybody, but a very high percentage. And I think I have an article that tells the percentages on that too. So yeah, just intro to today, because we're going to start talking about it. And then we'll do some lives with just more information in between. And then maybe in January, we'll do another panel. In my area, doctor will not give me mental health. What, Christina? That stinks. Well, you have to be close because you got snow. So where are you located again? I'm sure you told me, but I never remember. So yeah. So yeah. And sent before I finished. Okay. I was born with a lot of health problems, so pain came first and a lot of surgeries and hospital stay when you were little. And those type of things do cause you to become depressed, because especially if you're a kid, you can't do what the other kids are doing, all that. Oh, Christina, yeah, you're right near me. I'm in Michigan, and so yeah, the temperatures are very cold. Yep. hmm So yeah. They do a lot of things around here. Like we have the Children's Hospital, and they try to do a lot of things at Christmas. And actually, some stuff started during the pandemic where they couldn't go in and see the kids, but they could be outside. So they do this light thing for Christmas where they go out there with flashlights and they flash them. Then the kids in the hospitals flash them back. And I think they do some Christmas carols and stuff just to lift the spirits of the little ones, you know. Um, so there's a lot we can do to help other people as well. Can't have Ativan and pain meds, drug test mandatory every 6 months. Oh my gosh. Do they think you're gonna abuse it? Or just in your body, I know Ativan is it's a benzo type medication used for anxiety. I have used it before. Um, yeah. Hmm. So, okay, I need more coffee. I'm lagging. I keep thinking about my sister saying how it's taking forever. So I'm just glad that you guys are here and you are patient with me and you are caring and kind. Um, so when she said she didn't finish it, I was like, okay. um, so okay, so we're going to talk about basics of what chronic pain is today. And we're going to talk and take questions just like we always do. And like I said, I'll post on my community tab. Hopefully I remember after this live and I'll put it in there for next Wednesday. Just any pain, any questions about chronic pain. I would love it if Lazarus Naturals would just send somebody maybe just for like 5 minutes and we could ask them pains. She says it's government regulated order. Maybe it's me. Oh, no, it could be. It absolutely could be because there's federal and then there's state laws. So I know in Illinois and Indiana, I think they're much stricter on any type of medications. Um, so so it could be state if it's not federal. So that yeah, very well could be true, Christina. Everybody, because of the opioid crisis, and this is the part I don't understand. And you guys, the chronic pain warriors, you've already been going through it, that they want, since everything has gone out about the what was called Oxycontin, everything's gone on about it. And they let that stuff come through and they gave it to people and they pushed and pushed it. Tennessee is very strict. Yeah. Yeah. Um, and even like with alcohol in some states, very strict too. Already don't feel well. His got to drive every 3 months or lose your meds. Oh, yeah. Indiana wasn't too strict, but Pennsylvania is incredibly strict. Yeah. Yeah. See, Michigan is not as strict. But my sister, she's not here. She'll be here next week. She gets the Oxycontin for pain, I believe. It might be something different, but the same thing. Her doctor's always trying to cut her back, cut her back, cut her back. And it's like, I'm in pain. What do you want from me? And so she is a big proponent of CBD and she knows a lot more than I do about it because she uses the CBN or CBG. There's a bunch of other stuff. We'll talk about all that too. And then what we might do is after the panel, we'll talk about some of the stuff that we covered in the panel. And then the next panel, same thing. So, because it's really becoming a big part of my life and we talk about mostly stuff I'm interested in or you guys are interested in here. So, yeah. Okay. So, Michigan is not as strict. And you know that in Michigan, the um, THC is legal medically and recreationally here as well. For pain, well, it's recreational for other people, but medically it was for pain management. So Michigan is not as strict, but I know still on the opioids, that's federal, the opioids, and they're like, keep trying to cut her back and cut her back. And like I was talking with Jamie, that you've been taking a certain amount for so long and you develop a tolerance. So when you start cutting back, the pain is just going to increase and increase and increase. Um, so I think my sister's getting something else in there besides the Oxycontin. She'll talk about it when she's here next week. I don't know as much about it as she does. So she's veritable. You know how I like a lot of information about mental health. She's good at telling information about that. So first things first, chronic pain. Let's go to present. Share screen. Don't show these tips again. Yeah. I did have to go on my free account. Did I tell you that already, Jamie? So, okay. Share. Position. Okay. This is Cleveland Clinic, which you know is one of my trusted sources. So we're going to come back over here. There it is. Okay, it's on there. But since this is my account and I've just gotten back onto my StreamYard account, it's giving me all this new stuff. So I get all these pop-ups and everything. So let's put this one is my favoritist. And then I want to do full screen. Okay. Sorry, guys. I'm having some trouble. Here we go. Let's see if that'll help. No, that's not what I wanted to do. Okay, here we go. Chronic pain lasts months. All right. Chronic pain lasts months or years and happens on all the parts of the body. It interferes with daily life and can lead to depression and anxiety. Can lead to. The first step in treatment is to find and treat the cause. When that isn't possible, the most effective approach is a combination of medications, therapies, and lifestyle changes. Okay. Chronic pain is pain that lasts for over 3 months. The pain can be there all the time or it may come and go. It can happen anywhere in your body. See how generalized this is? It's anywhere in the body. It may come and go. It may just always be painful. So I don't know. I wish they were doing more studies for chronic pain. I don't think they do as many studies as they should be doing. You know what I mean? They're checking on the opioids and things, but they're not studying what's causing it, and giving different types. I mean, because chronic pain is such a general term, a big, big, broad term. Chronic pain can interfere with your daily activities, such as working, having a social life, and taking care of yourself and others. And that is all true. It can lead to depression, anxiety, and trouble sleeping, which can make pain worse. And then also, the pain can be so bad that you have trouble sleeping as well. This response creates a cycle that is difficult to break. Um, so, let's see. Put my face back up here. Where's my closed tip? Here I am. I hate the pain manager. Doctors don't understand what it's like to be in pain. I really think if they did more studies and talked to more people, they would have more information. But I don't think they just want to give you the drugs and make you go away. They don't want to deal with you, right? Is that a lot of people's? I truly had to choose mental health meds or pain meds. I chose mental health meds. It's a different, and you shouldn't have to make that choice, Christina. It's so they need to do more research. Why aren't they doing more research? Because you shouldn't have to choose between your mental health meds and your pain meds. You shouldn't have to. There should be more they should do more research on pain medications. Everything doesn't have to be a narcotic. Why aren't the drug companies doing more of that? Because they would rather just push out the narcotics and whatever they already have because they're making money hand over fist. We know that the what did I say? Prescription, the pharmacies, pharmaceuticals companies. I'm having trouble talking here, but why aren't they making pain meds that aren't narcotics? There's got to be other things available. Why aren't there? And I know when you go to pain management centers, that's they're specializing in. I haven't done that yet, but I know that a lot of you guys do go to pain management centers. And it's kind of a last resort. It's like nothing's working. I have to go to pain management and figure out what's going on. I wonder if they have enough information. Do they need more studies? They need more information. They need more tools to help people with chronic pain because, as you can see from this introduction, it can be anywhere. It can happen at any time in your life. It can be chronic pain always. It can just be back and forth. It hurts, it doesn't hurt, it hurts, it doesn't hurt. You know, it's so general. Why haven't we come and made it smaller and smaller and smaller so that we know, well, I have arthritis, which I have chronic pain with as well. What can I do besides take an opioid for my pain? And that's where the CBD, they are researching the CBD and the THC, which I'm so glad about this because that is one thing that there's no side effects for me that I can take. It helps me sleep. And when I wake up in this weather, I still am achy, but if I don't take it at all, I am in so much pain. I have to take aspirin and stuff. And I don't do that on a daily basis. I just take the CBD. Took years for them to approve both my mental health meds and pain meds together. They said they didn't like to mix them because of side effects. Yes. And you have a really good team. We've talked about that before, Joe, where I don't think Christina's got as good of a team. And it seems like her doctors aren't helpful. Am I wrong, Christina? Am I wrong? Because you shouldn't have to choose between mental health and pain management. You shouldn't have to be in pain, and then you should have good mental health. Why? I, I, I maybe I should have been a doctor, but I was too lazy to be a doctor. I couldn't do all that school and stuff, and I don't understand why they're not more curious. As a person, I'm curious. As someone who is having chronic pain, I'm curious. And who has mental health issues, I'm curious. Why aren't the people in the fields as curious as me? It's the lows here, she said. It's the lows here, she said. Oh, okay. When I had the pain pump, they didn't care how high the dosage is, but when they removed the pump, they started weaning me down the dosage to meet DEA regulations. It's not right. Right, because you were already prescribed a certain amount of medication to manage your pain. Why now do they think they need to change it? Why? There are no studies. There are no studies about that. That there are no studies that say weaning you off your pain medication according to the DEA is beneficial for your pain or your mental health. There's no studies for that. So it's the law. Oh, the laws. Okay. I'm sorry, I read that wrong. And like I said, Christina, that more states can be more restrictive as well. When I had the pain pump put in, okay, okay. And hopefully, once you get the pain pump put back in, and see now that they've lowered you, that's what they're going to put in. And then they're not going to want to raise it for you. It's a cycle of ignorance, um, of us not being understood, ignorance on the doctor's parts, I mean, and also not enough studies, not enough things to back you up. Because a lot of time, well, for a long time, people with chronic pain were just told, get over it. You're fine. It's all in your head. I'm sure you guys have heard it all because the doctors get flagged here in Pennsylvania if they prescribe more than a 50 milligrams a day. Pennsylvania is very strict. Um, yeah. And that's what I'm saying. So the government is in our medication now because of this stupid, whatever the name of that pharmaceutical company was that did the whole Oxycontin crap. They were wrong. And what they did was wrong. And they hurt more people than they helped. Yeah. So, and that's what caused all this cut back on pain meds, cut back on pain meds. They're addictive. Well, they are addictive, but when you're in pain, you're using them for pain. You're not using them to get high. You're using them to feel better. You're using them so you can function daily as a human being and enjoy your life. And I just don't see, we'll have to dig deeper, but I don't see the studies. I don't see the information out there. I don't see any new drugs being developed. You know what I mean? I don't see all this money that goes into the pharmaceutical companies, and they haven't found anything else besides that to help with pain. Because when it's not when it's not severe and it's not chronic, you can use aspirin, Tylenol, all the regular stuff. You can use that aspirin cream. Um, but the CBD is working for me, and I am going to keep on that train. I enjoy it. I don't have any side effects from it, and but I am at a high dosage. I do 300 milligrams a night. Same here, Jamie. Okay. Yeah. And that's government interfering in our medical and our mental health. If that stupid company had not done all that shadiness, we wouldn't have had this. I don't think that this would be what it is now if they hadn't have done what they did, that company. And I watched that movie. I still can't remember the name. My pump was at 150, so they weaned me back almost half so they don't get flagged. They don't care if you are in pain as long as they don't get flagged. Do you see that is wrong? So wrong. So wrong. You know what I mean? I'm going to get flagged, so you're going to suffer, is pretty much what the doctors are saying. And there's no alternative for you because no one's doing the research. Nobody is studying it. Nobody, you know what I mean? They're like, we make enough money from these drugs. Why would we develop something helpful? Why would we do that? In my mind, I don't understand it. I don't want to say it's a conspiracy because I don't think that. I just think the government's involved because of what happened with the Oxycontin scandal. And unfortunately for us, now that their nose is in it, they don't care about our pain. They don't care about our pain level. They're not interested in our pain management. They have these specific guidelines. They're saying these specific things. And that is why it took so long for them to approve cannabis, because of all this other, because of the money, because of the pharmaceutical companies. And finally now cannabis, the research is better. They're doing a lot more research into the chronic pains. They're separating out all the different things in the cannabis so you don't have to have the THC if you don't want the THC. I know there's CBG, CBN, CBD, and THC. There's more than that, though. Those are just the ones that I'm aware of. And the only one I have knowledge about really is CBD. There's not a lot of, they need to do more research into the THC side of things as well. But I do know the CBDs help with inflammation. Well, they help me with pain. They help me with my mental health. I get a good night's sleep. So when I wake up, when you wake up, if you have a bad night's sleep and you're already in pain, you're going to have a bad day. For real. When he asked my pain level and I told him, he basically called me a liar and changed my number so he could justify lowering it. See? Bad doctors. We don't, not only do we have mental health doctors we have to check, we have pain management doctors we have to check, and our general practitioners. We have to check those people because they're doing what the government is telling them. They're not helping us. You know, if anybody knows of any new drugs or any new treatments, like mine is CBD, that's what I'm using now. I do have the aspirin cream, which has the it's basically aspirin in a tube you can put right on your finger or your knee or whatever hurts, so it doesn't go through your liver, so it's a little bit better for you. I do use that when I feel like it's necessary, but I think as my chronic pain gets worse, my tolerance is going up as well. So I haven't been using any oral medications yet. So I have not had like a spinal surgery like several of you have had. My knee surgery, my knee is getting worse, the one that I needed to have surgery on. And I don't know if I told you last week or the week before, I did lose my health insurance, but I will be eligible for Medicare in March. So it's not going to be long. I'm going to schedule the surgery for the knee that didn't have surgery yet, because that's the one, the knee that I had surgery on still has pain. But the knee I didn't have surgery on has increased pain, especially with the weather now. So it's getting worse. And I am starting to be able to kneel on that surgery knee. It will be in March, it'll be 2 years, but it still hurts to kneel on that knee. Um, you just have to keep on keeping on and working on it. And they don't tell you that it's going to be 2 years, but and you're still going to have pain. They didn't tell me that, but that pain is now exceeded by my knee that does not have surgery. So, um, so chronic pain frustrates me, not us. The caretakers and the people who are supposed to help us, they frustrate me to no end. Really, they do. And I'm sure that you guys have a lot of frustration about that as well. So let's go back to the article and see what we have going on over here. There we go. Did I hit the wrong article? No. What is chronic pain? What's the difference between chronic pain and other pain? That's what we want to talk about. Chronic pain differs from another type of pain called acute pain. Oh, I have a FedEx. Hopefully they're bringing me my Janessa Myrix. Okay. Chronic pain differs from another type of pain called acute pain. Acute pain happens when you get hurt, such as experiencing a simple cut to your skin or a broken bone. It doesn't last long and it goes away after your body heals from whatever caused the pain. In contrast, chronic pain continues long after you recover from an injury or illness. Sometimes it even happens for no obvious reasons. Chronic continues long after you recover from an injury or illness. Sometimes it even happens for no obvious reason. Where do people have chronic pain? Chronic pain can come in many different forms and appear across the body. Common types of chronic pain include arthritis or joint pain, back pain, neck pain, cancer pain near a tumor, headaches, including migraines, testicular pain. Let me scroll down. Lasting pain in scar tissue, muscle pain all over, such as with fibromyalgia, neurogenic pain from damage to the nerves or other parts of the nervous systems. How common is chronic pain? Chronic pain is a very common condition and one of the most common reasons why some people seek medical care. Approximately 25% of adults in the United States experience chronic pain. Okay. So I don't know what the population of the United States is, but let's say I think it's more than 10 million. But if it's 10 million and 25% of people, let's say it's 100 million because it's easier to do percentages that way. So 100 million people, and I know there's way more than that. 25% is going to be 25 million. That is a lot of people. That is a lot of people in pain. And for them to not be pursuing any type of other cures, things like that, is very frustrating for me. Very frustrating, as well as I'm sure it's frustrating as well for you guys as well. What's going on here? Okay, there we go. So let's see. Are there any other questions, or I can just keep reading? I'll just keep reading so we can take a look. See. Symptoms and causes. And I believe when we're reading this, are you seeing how general things are, how like wide open the categories are? You can have arthritis in different parts of your body. You can have different types of arthritis. And I would imagine that different types of arthritis maybe need different types of pain management. But they don't break it down that far. There needs to be more education, more research and development, just more. Sometimes chronic pain has an obvious cause. You might have a long-lasting illness such as arthritis or cancer that can cause ongoing pain. Injuries and disease can also cause changes to your body that leave you more sensitive to pain. These changes can stay in place even after you've healed from the original injury or disease. Sometimes, like a sprain, a broken bone, or a brief infection can leave you with chronic pain. Some people also have chronic pain that's not tied to an injury or physical illness. Healthcare providers call this response physiogenic pain or psychosomatic pain. Okay. It's caused by psychological factors such as stress, anxiety, and depression. Many scientists believe this connection comes from low levels of endorphins in the blood. The endorphins are natural chemicals that trigger positive feelings. It's possible to have several causes of pain overlap. You could have two different diseases, for example, or you could have something like migraines or psychogenic pain together. At least they don't call it phantom pain. Hey, Kelly, how are you doing? Um, because for a long time, people with chronic pain were just told, you guys, I have to use the bathroom. I am going to have to, mm, I'm going to just go. I will come back. The bathroom's just right here. So I have to go. I cannot wait. And so I'm just going to leave this article up. And I will hopefully not be too long. And hopefully you guys will still be here. So I raised that up and talk amongst yourselves. I'm sorry, but I cannot wait. So I will be right back. I am so sorry, everyone. I'm doing good, just resting. How is your day so far? We're glad to see you, Kelly. We're so glad to see you. Okay, so this is a live. I apologize. That's life, I suppose. So we're going to get back to it. Okay. Let's go back to the chronic pain. What does chronic pain feel like? Again, it's going to be very general. Everyone's pain is different. people with chronic pain describe their pain in many different ways, such as, see, people with chronic pain describe their pain in many different ways, such as, why aren't we doing more research into these things? Why aren't we? Aching, burning, shooting, squeezing, stiffness, stinging, throbbing. Chronic pain often leads to other symptoms and conditions, including anxiety, depression, fatigue, of feeling overly tired most of the time. Because with chronic pain, you're probably not sleeping as well. Insomnia or trouble falling asleep because you're in pain. Mood swings because you didn't sleep well and you're in pain. I mean, they already know all this kind of stuff. How is chronic pain diagnosed? Let's see what this has to say. Pain is considered to be chronic if it lasts or comes and goes for more than 3 months. Pain is usually a symptom, so your healthcare provider needs to determine what is causing your pain, if possible. Pain is subjective. Only the person experiencing it can identify and describe it, so it can be difficult for providers to determine the cause. If you have long-lasting pain, see your healthcare your provider will want to know where your pain is. How intense is it on a scale of 0 to 10? And they should believe you. How often it occurs, how much it's affecting your life and work, what makes it worse or better, whether you have a lot of stress or anxiety in your life, whether you have any illnesses or surgeries. See, very general information. Excuse me. Your healthcare provider may physically examine your body and order tests to look for causes of the pain. They may have you undergo the following test: blood test, electromyography to test muscle activity, imaging tests such as x-rays and MRI, nerve conduction studies to see if your nerves are reacting properly, reflux reflex and balance test, spinal fluid tests, and urine tests. Just fighting tooth pain. Yeah. So how are you doing? You said you're doing good, just resting. Okay. How is chronic pain treated? To relieve chronic pain, healthcare providers first try to identify and treat the cause, but sometimes they can't find the source. If so, they turn to treating or managing the pain. Healthcare providers treat chronic pain in many different ways. The approach depends on many factors, including the type of pain you have, the cause of your pain, if known, your age, and overall health. The best treatment plans use a variety of strategies, including medication, lifestyle changes, and therapies. If you have chronic pain and depression and or anxiety, it is important to seek treatment for your mental health condition as well. Having depression or anxiety can make your chronic pain worse. For example, if you have depression, the fatigue, sleep changes, and decreased activity, it may cause can make your chronic pain worse. Oh, and decreased activity, it can cause or it can make your chronic pain worse. I still think there could be other breakthroughs in this area. I think if there was more research into all different types of things for pain, clinical research, like there are therapies like acupuncture. We don't know a lot about that. That's big in Eastern medicine, but I think they need to do more investigating and studies about that here because it could be something that you could have prescribed to you if it's something that works. Um, what other types, natural ways to deal with pain, even more pharmaceuticals, different pharmaceuticals. There have to be other ways to manage pain. Sorry, I was making something to eat. No worries, Jamie. I had to go away for a minute as well, so no worries. Um, so this live is all about how frustrated I am with the whole chronic pain scene. All right, main What medication can treat chronic pain? Your healthcare provider may recommend certain medications to relieve chronic pain, including anticonvulsants, medications that prevent seizures for nerve pain, antidepressants, such as tricyclic antidepressants, corticosteroid, muscle relaxers, non-steroid anti-inflammatory drugs, NSAIDs or acetaminophen, topical products applied to the skin that contain pain relievers or ingredients that create soothing heat or cold. Opioids. Opioids can be addictive and you can build up a tolerance to them over time. Because of this, healthcare providers usually try other pain treatment options before prescribing opioids. Sedatives to help with anxiety and insomnia, medical marijuana, other medical treatments your healthcare provider may have you try include TENS, transcutaneous electrical nerve stimulation. This procedure delivers small shocks through patches on your skin. The electrical impulses can relieve pain. Nerve blocks. For this treatment, your healthcare provider injects an anesthetic near the site of your pain to reduce feeling in the area. Nerve blocks can also sometimes provide diagnostic information and locate the source of your pain. Epidural steroid injections. This procedure is an injection of an anti-inflammatory medicine or a steroid into the space around your spinal nerves known as the epidural space to treat chronic pain caused by irritation and inflammation of spinal nerve roots. Are there side effects or complications of medical treatment for chronic pain? I'm going to go with yes. Okay, I was just checking to see if there was any more questions. Oh, I didn't have you guys up on the screen. I am so sorry. There we are. But yeah, it sounds like there are a lot of different treatments. I have never been offered all of these treatments. I don't know. Is that what they do with the chronic pain management? Do they go through all those different types of treatments? Anyone here who's been through the chronic pain management system? Does any of that sound familiar to you? Chronic pain makes me angry. I had my back open and last year re-sewn without numbing med in the ER, but they say I'm not in the pain. I say I am. I know they don't believe you. Why? Why don't we have some? They ask from 1 to 10, what is your pain? That is the worst scale ever because they're saying your 10 is not their 10. I have fibromyalgia. I am on Tramadol. Okay, I have used that before, that after surgery. And I want to say that is that an opioid? But I want to thank you for letting us know that, Kelly. That's very brave of you to participate with us in this. I appreciate that. I appreciate that a lot. Yeah. Yes. So I just in this day and age, in this day, with all these with the AI and all the TikTok and all the blah blah and all this stuff that's useless, why isn't there more research into something as important as chronic pain? They like to give injections because they don't work and then they get paid per injection. I had the steroids put in my knees. They didn't last for like a day. My knees were really bad. They didn't do anything for me. So, but here was the thing, from the injection that didn't do anything for me, there was physical therapy after that, which was painful because I was already in pain. It's supposed to strengthen the muscles around the area so that there's less pressure on them. So that didn't do anything. And then my next option was surgery. So now after the surgery, I do have chronic pain in that knee. And now they just want to give you medication for it. There has to be more research. I mean, I'm going to have to do more research myself, but there has to be more stuff done for people with chronic pain. There have to be more options. There have to be. And I don't understand why there isn't. So, and yeah. Now I don't know about the other, what was the other one we were just talking about? Some other chronic pain things like I've never heard of. So we'll go up here. Like when it said treatments, now I don't have the back trouble, but so the convulsant is for nerve pain. Medications that prevent seizures. I already take antidepressants. The corticosteroid is what they put in my knees. Muscle relaxers. I've taken that for muscle pain. You know, non-steroidal, those are over-the-counter NSAIDs or acetaminophen. I have those in my cabinet, but I don't take those immediately. I prefer to take topical products that contain pain relievers or ingredients that create soothing heat or cold. Like I talked about the Aspercreme, topical, icy hot, how when you go into your grandma's home or whoever's home and you smell that icy hot smell, my house smells like that a lot too. So I use a lot of patches. I don't really like the cream on me, but I have a lot of the patches. I do like the CBD muscle stick from Lazarus Naturals. When we do the live, I'll bring some of the products I use and we'll look at them on the screen. So topical, the opioids, I haven't gotten to that point. I'm going to save that because it may come to that. And the way that they're doing this now, I'm hoping by the time I need to go that route, there will be other options, you know, there will be other options. Sedatives to help with anxiety or insomnia. And I would choose over opioids, probably medical marijuana. But I have difficulty functioning on THC. Now, the CBD is working really well for me, and I could use it in the daytime, but it does make me sleepy. I would need to work out how much for the daytime, and I haven't done that yet. So, but if it's really bad, I'll just take like 100 milligrams in the morning, but it puts me to sleep. Now, the TENS unit, I've used that before for muscle pain. What was it that I need? Oh, I got it from the chiropractor for my back from when I was an electrician. So I have used the TENS unit before, and that's nice, but you have to leave it on. And when you turn it off, the pain comes back. So let's see. I'm back. I took a pain pill to see if it helps. Okay. Okay. After my last kidney operation when I was 5, and it was like my 10th one, they said as an adult I shouldn't get they were wrong. Oh, you shouldn't get many UTIs. Is that what it? But they were wrong. Yeah, they don't know everything. That's why there should be more research. I know, I appreciate that we have doctors. I do. I wish that research, it costs money for research. I wish that maybe our government could put more money towards research. I don't know where the money would come from, but we need more research done about chronic pain. And there's no doubt, I believe that wholeheartedly. And if you have another perspective, please feel free because I'm open to anything mostly. I had to wear those bags front and back. Oh, ouch, Wilma. Oh, so painful. So painful. I didn't have to do that when I went through my kidney stones, but they said I might have to. And I was like, you do the best you can not to have to leave a hole in my body, please. And so they didn't. I was able to go through the kidney stones and dressed all the time. You have to, yeah. Because you have to keep from getting infection. You have to keep them clean. Okay, so we're back on this page. We were talking about different types of, okay. So TENS units, I've used those before. Has anyone here used a TENS unit before? They're little patches you put on your body, and they run electrical impulses into your muscles, And it's almost like I want to say, does it feel like vibrations or little electrical pulses? And if you wear it, but when you take it off, the pain comes back. So if you're, I guess the reason for it would be to put it on, then take some medication, and then Kelly said she's scared of those. And yes, because fibromyalgia is a muscle, is chronic muscle pain. You would not probably, that probably is not prescribed for fibromyalgia. I'm not sure, Kelly. I don't know a lot about it. My sister has fibromyalgia, and I don't think she uses the TENS unit. She has one, but she does not use it. That was one of the many reasons why I couldn't be a normal child, right, Wilma? The TENS unit did not help me, Jamie said. We understand, Wilma, and we're glad you're here and sharing your story with us. That's very brave as well, I think, in my opinion. So, let's see. So I think that the nerve block, I think Joe was talking about the nerve block. For this treatment, your healthcare provider injects an anesthetic. And I have never had that done. But I would think that that is probably a more advanced treatment. And then the epidermal steroid injections, I think that would be a more advanced treatment as well. So there's things available, but I think there should be more available. Am I wrong, you guys? Am I just talking like, am I just being an idiot? I think there should be more available. And I'm glad with all the research they're doing into CBDs. I really am. I hope they continue. I have a friend that has fibromyalgia, and they passed medical marijuana, can't spell that word, and now she is addicted to it after preaching to me about her. Um, now, there are some, you can become psychologically addicted to marijuana, but you will not have withdrawal symptoms if you stop smoking it. So it's not physically addicting. It doesn't cause you to have withdrawal like an opioid or alcohol or anything like that. So that's one of the things about it that is good. But you can become psychologically addicted to it because without it, you maybe don't feel good. And if she's doing it all the time, it's highly possible she's medicating some type of a mental health issue. That's my experience with people who smoke a lot of weed. There's usually some anxiety under there. Um, let's see. I have been hurt 20 years. I doubt there's anything I haven't done. That's why it was eligible for the pump. Okay. And there should be more things. And the pump is great. When you had the pump, you said you were feeling good, things were going well, but it's got to be fairly new because the procedure was just screwed up. Do you know what I mean, Jamie? There's got to be more people learning how to put the pump in, and it's hard for you to find somebody to fill the pump. And there's like one or two people in your area. You don't have a lot of choices, and they do. Thank you, Joe. Or she has withdrawn symptoms for her ex told me this. Oh, it's not physically. If she's having withdrawal symptoms, it's not the marijuana. Because I know people, and when they don't do it, they get grumpy, but they're not in any type of physical danger. So I guess I would want to know her symptoms, and she needs to go to the doctor, obviously. Um, but I particularly am not a fan of the THC, but I may come to a point where that's the only thing that takes my pain away. So I will use it when it's necessary. Um, but physical withdrawal symptoms don't occur with marijuana when you stop it. Hi, Robin. How are you? I saw the Dollarama finally, and I was thinking of you. Welcome. I'm good. I'm good. How are you? Yeah, Wilma, maybe we'll do one on THC as well. We'll go through and see what the medical people say about it and stuff. But that's why it didn't make any sense for them to make it a Schedule 1 drug, because there aren't really any physical withdrawal symptoms other than people like the way they feel when they're high. So they want to be high. And that is a mental health issue. So um so it's complicated. It is complicated. But medically, if I'm at that point and that's what I need to do, I will. I choose to not yet. Not yet. I'm taking slow steps. I'm doing my research because doctors don't know everything. They don't. So you have to do your research, and if they're questioning you, print that crap off the internet and take it in there and tell them what it is. Um, because I can't believe how many doctors don't believe us. I can't it I have a doctor that does, but I've seen doctors that don't, and it concerns me because you should always be open to what your patient is telling you. You should always be open to that. Isn't that part of being a doctor? How can I help you? Not, oh, you're here, you're annoying me, you're whining, you have pain, here's a prescription, go away. That's not how it's supposed to be. It's supposed to be, I'm here to help you. What can I do for you? And maybe that's just me. Maybe I'm immature and I think everybody should be like that. But I don't get doctors who just don't care. Seems to always find the creepy doctors. Yes, you do. Crappy doctors. Yes, you do. I think it's a Pennsylvania thing though. Yeah. Anybody from Pennsylvania who has a good doctor, please inform Jamie. Oh, and that's the worst, Robin, when they retire, sometimes the people that take over the practices are still good and hopefully at least have the same ideals that your original doctor did, but they get older. My husband's doctor, she's only available like 1 day a week now. She keeps cutting back and cutting, and she's going to retire soon as well. So he did get another doctor because his insurance was different, so he had to get to another doctor. But that that is yeah, that happens a lot. I don't like my doctor. Man, and her nurse got hateful with me last visit. I won't go back for a while to her. See, and why? Why do they need to be mean and hateful like that? I don't get it. If you're here to help me, you should be open to listening to what I have to say, why I'm here. I don't come here on a whim. I don't come here because I have free time. I come here because there's a problem. Okay? One of my former doctors did not believe in fibromyalgia. That was such a crazy time before they actually really did the research and they decided yes, it is a real disease. Hello, people are suffering from it all over the place. Yeah, it was so frustrating. It was a relief when I found a team that advocated for me. Yes. Oh, no worries, Wavy. We're still here. Um, my one pain doctor had me on 300 milligrams of Oxy a day. Then she got flagged and put me down to 90 in 3 months. That's awesome, Joe. Yes, yes. Finding good doctors, that is like, and that they take your insurance. So not only do you have to find a good doctor, you've got to find a good doctor that takes your insurance. It's because when I worked, I had the best insurance, so I didn't have a lot of problems. But now that I am retired, disabled, retired, whatever you want to call it, I am finding, and especially with my husband, he's been uninsured, just how crazy the system is. Because when I had good insurance, so did he. But when I got off work or out of work and disabled and all the things, he became uninsured and I was uninsured for a time. Then I had Medicaid for about a year, and then they said I'm no longer eligible. So that's where I'm at right now. Um, I turned down a test I knew I didn't need, and they argued with me. I walked out. If you didn't think you needed it, why would they argue with you about it? I don't think I need that test. Okay, well, maybe we'll revisit it at a later date. and bye-bye. Why they got to argue with you and get nasty with you? That just strange. LPN took place of my 30-year-old doctor. She sends me a specialist on everything. I cut my finger. Oh my, I'll send you to the cut finger doctor. You must have good insurance, Christina. Doctors cause the opioid issue, and now people who are in pain have to suffer, in my opinion. That's true. The pharmaceutical companies and the doctors together. Yeah. I can't remember the name of that movie, but it was recently, I think it was on Netflix, and Matthew Broderick plays the bad guy. And it's about the pharmaceutical company that created they use all the names of the real people and the real business. The real people who created OxyContin, how and why they created it, and what they knew when they did create it and give it to people. And then the doctors, they got the doctors involved. There were bonuses, there were gifts, there were things for the doctors if they kept prescribing so many OxyContin and raising it. And so if this isn't helping your pain, we're going to raise it to 100 milligrams, and that's how it was. And the FDA, it went through FDA approval. They show you how shady that approval was. So FDA approved, in my opinion, you still need to be cautious about, because OxyContin was FDA approved. So yes, Joe, it was the series called Painkiller. It had the one lady who, I can't remember her name. She's African American, but she was, well, I can't remember what she was part of, but she was investigating the opioid epidemic before it became the opioid epidemic. She was one of the first people to whistleblow on it. Yeah, so I think it was called Painkiller. Yeah. Yeah, they want the insurance claim, and that's wrong too, woman. For them to want you to do that just so they can get paid more money is not right. That's what they talk about in that Painkiller movie. Was it a movie or a TV show, a series? It was like a couple, 3, 4, maybe. It was excellent though. If you haven't seen it, Joe, if you have seen it, you know it's excellent. So, yeah, that should not, my care should not be contingent on your bonuses. My care, my health should not rely on pharmaceutical companies and brands and people giving my doctor things to give me these treatments. It should be a treatment that is proven, or at least researched. What is it called when they do studies? They do those studies, clinical studies. That's what I want to say. I would believe a clinical study, a double-blind clinical study, before I would believe the FDA, to be honest. Matthew Perry was taking 1,800 milligrams a day. Did you read the book? Was he taking that when he was in the height of his drug addiction? Those injections are just a money issue. They don't work, but they get paid a lot to do them. Now, I know people who've had the steroid injection and it's worked for them, but mine was so far along that it didn't. And I've also heard that you can only have it done so often, because if you have it done too much, it's not good for you either. I have another doctor we like real well. If I need something, he makes sure I get it. That's good, Wilma. Because you really have to. WOE. Whoa, Robin said. And he doesn't fight me. We discuss the situation. Wow, I mean, yes. So good doctors are important, but hard to find. Hard to find. I'm not going to lie. I'm not going to say it's easy to find a great doctor. It's not. My treatment shouldn't be dedicated based on insurance, on pharmacy companies, and or other addicted. Yes, I agree, Joe. Your healthcare provider should base all your information, your treatment on you, not any other influences. And I like a doctor who keeps up on current treatments. I'm not opposed to trying something new that's been studied. I'm not opposed to that. I would not participate in the study because I don't want to be a guinea pig, but I would try something that was new, that had been studied and shown to be safe and effective, Um, and I am smart enough to know that not every medication I take is going to work for me. It might work for you. It might. That's why the chronic pain is so broad, because they have all these different treatments, but they don't say, well, for arthritis, this is the best treatment. They just say we go down. It's process of deduction, elimination. So this one didn't work, so let's try this. This one didn't work, so let's try that. You know what I mean? It's like, we won't let this one go, right? I had the steroid injection and nerve block, and it helped for 36 hours. Oh, that's good. That's good. Um, but right, our treatment should be based on our situation. And there should be more research done into different types of pain. There should be more research done into pain management. If they don't want to give us opioids, then find something better. Research it. Look for something better. There has to be somebody figured out how to make Oxycontin. Why can't they figure out how to make something that's non-addictive, that's helpful to us? Why? Do you know what I mean? It's all about money and greed, and it's not about our benefit. It's not for our benefit. It's for their benefit. And I don't. Um, but that painkiller will clarify a lot of stuff that you suspect already, but it will clarify a lot of it. My hubby doctor and him became friends. I like him and his family. His doc's from North Carolina. We have that in common. Okay. And it's hard to find a good doctor, Wilma, so definitely hang on. My injections and nerve blocks worked for months, but then we tried ablations and they worked the longest. And see, and that is that a newer treatment, an ablation, Joe? Because I'm open to newer treatments that have been studied, that have studies done about them. I'm open to that kind of stuff. I want a doctor who is also open and concerned for my safety and my wellness. And they're not going to send me down a wrong path with something because somebody's going to give them a big bonus for having me do this treatment. So, unfortunately, people can be greedy. I asked for something other than morphine, and the doctor said if morphine isn't working, we'll have to wave his white flags like WTF. See, there's got to be more stuff. It's that those things work, so they're lazy and they're like, we're making money off this stuff. We're not, they're lazy. If they could make something that would help, I gotta go. You guys take care. Have a great day, Robin. Have a great day. My hubby made him a homemade fishing pole and tried to pay for it. We said no. Oh, that's nice. That's nice. So let's see. I was just going off about pharmaceutical companies, but it's why can't they find more stuff? Morphine's been around forever, so it's tried and true. I get that. I totally get that. I know that opioids are tried and true. They're trying to take them back away from us, but they work. But there has to be something else. Why can't there be something else? Why can't they find something else? Did you move yet? Yeah, we finally finished everything in September. We're totally done with the other house. Totally done. So, yeah, have a great day, Robin. I don't know if you're still here, but have a great day. Yes, all done. And I think that's why like we finished the end of September, and then for like October, November, when was I sick? My husband gave me like a stomach bug. Like beginning of November. And then once I started to feel better just before Thanksgiving, I actually felt really good. And I was like, I don't think I'm stressing about the move anymore. I think I'm finally it's finally done. So, yeah. Okay, let's see. How long have I been ranting and raving, you guys? You guys are so patient with me to listen. And let's see, where's the time? There it is. 1:19. So we just have like 10 more minutes. Yeah. And all I'm doing is yelling about these pharmaceutical companies. I know. I know. But yeah, just There's always something else. There's always something else. Why are they not looking for something else? If you want to take this one away, and that company still makes OxyContin, it's just now that the government's regulating it. They still make it, and they did get sued for lots of money, but I still think that company operates, and the people who own the company are in jail, but they're still making money. So why can't we find something else? Why can't we find something else that is, um, I don't know. There's got to be something. You know what I mean? My little baby hairs are always bugging me because they stick right up. I had that had gotten really thin, like this side, when I was sick last year, and now it's just starting to come back. Hey, did y'all car insurance go up? Ours sure did, but he found a good one now. Um, Mine went down because we took a car off of it. So it took 10 years, but I'm so happy with my doctors now. They not only suggest new methods, they provide me with information, websites, so I can decide if I want to do it. The only hard part is getting insurance to cover new methods. Yes. Anything that's new, insurance doesn't want to cover it. Why? Why is that? Because the treatments are expensive. Um, But yeah, if you're in pain, why and there is a new treatment that has been studied, that has been proven, why is it so hard to get the treatment for yourself? Yeah. So, if they give me some I don't care if they give me something weaker if it works, right? And it might not be weaker, it might just be different. You know, the human body is miraculous. It can heal itself of most things, right? As we get older, it's harder. I know. I'm an example of that. But more research, more funding. And that's the whole thing. That's the whole thing. Is like, is why is it so hard to get this stuff funded? The pharmaceutical companies are making so much money in America. We have the highest prescription pay of any country. I'm pretty sure. I should look it up, but I think I've heard that we pay the most. And that's because we don't have the United Healthcare, whatever that is, where the whole country has healthcare and stuff. Um, but they have the money to do the research as the pharmaceutical companies, but they're making money with what they have now, and so they're not worried about it. And OxyContin wasn't really it was a new, the product wasn't new, the coding for the product, that it lasted longer than the short-term effects of oxycodone. They put a covering on it, which made it last, they said, for 12 hours. That was not true. They lied. Um, so I think it's more like 6 hours. Correct me if I'm wrong. Um, well, our bed sheets, I gotta put on bed and start supper. Love y'all. Gotta do bed sheets. Have a great day, Wilma. It's been great talking to you. I hope you're feeling better too with the weather like that. I know how that can be, trying to get stuff done around the house and you're like creaking, cracking, you know. But yeah, so I have been hollering enough. I don't know, is that entertaining when I get upset like that? It really, I am such a logical person that when it doesn't make sense to me, I'm like, how are you not seeing this? How are you not seeing that there's a market for a better painkiller, not a stronger painkiller, a better painkiller that works differently than an opioid? There's got to be a way. More research. Maybe I'll start to become a chronic pain advocate as well. Buddy has to potty. I love you. I'll talk to you later. Yeah, we'll see you next week on our live. Have a good day, Joe. Mhm. And it's almost time to stop. Let's see. 24. We got like 5 minutes left. So, yeah. So that's the basics of chronic pain, what it is as opposed to acute pain. It's a very general term. It covers a lot of stuff. We need it more toned down. It's like when you have mental health issues, it breaks down into depression, anxiety. I think there's another category as well. And then it goes further that breaks down more that way. And that there are branches and branches and branches because they study this. Why they need to do more chronic pain studies. It shouldn't just be a generalization. That is my opinion. I am not a doctor or psychologist or anybody who really knows a lot of anything. Okay, I think we will go ahead and wrap it up. If you have any questions, we got a couple of minutes, go ahead and put them in the chat. I know it's just been a lot of pharmaceutical companies suck today. That's a lot of what I've been saying. But I know when we do the chronic pain panel, you guys are going to love it. You loved it last time. We got all kinds of different opinions, different people. And like I said, Jen hasn't contacted me. If she doesn't, I know Joe has left, but if there's anyone who's interested in being on the chronic pain panel, in case Jen is unable to make it, drop a comment, DM me on Instagram, all the stuff. And I will chat with you and see if you would make another good addition to our chronic pain panel. So thank you guys so much for putting up with all my hollering. And I appreciate you. I always feel better when I talk to you. And have a great week. I will see you next week, 1:30 live for the chronic pain panel. And Miss Jamie, I will hopefully talk to you later. And that's all I have for you today, guys. See you in the next video. Bye, everybody.